Health leaders are starting to speculate the COVID-19 pandemic could be heading towards an endemic. Rebecca Clough goes in depth to explain what that means and why there is still a major warning with that.
Nearly 2 years into the pandemic, and there's still a steady stream of cars at the Menominee Valley COVID testing site in Milwaukee.
I'm sick of it. It's changed the whole world.
But Wisconsin's top medical officer says we may not be dealing with a pandemic much longer. Dr. Ryan Westergaard says COVID-19 could become an endemic in 2022.
The phrase endemic, as you say, meaning that we've sort of reached a steady state of transmission. I think that's likely to happen during this next year.
The word endemic means a disease that's a regular part of the population, such as the flu. But other health leaders say COVID-19 may never reach the endemic phase.
A lot of people are and probably should be gun shy about making predictions about the future as it relates to COVID because it's really hard to predict. There's always a chance of new surges, which would kind of take it off of that track of endemic if you're talking about a new disease, essentially with a new variant.
March 11th will mark 2 full years of COVID-19 being in the pandemic phase. That's longer than the Spanish flu in 1918 to 1919, the Asian flu, which was from 1957 to 1958, the H3N3 virus known as influenza A in 1968, and the H1N1 virus, which lasted from 2009 until August 2010. But Dr. Dan Shirley with UW Health says the potential switch from the pandemic to an endemic doesn't mean people should let their guard down.
Even though we're saying the word endemic, and sometimes that means something that we can live with and it's not a big deal, the danger with that is certain diseases are more dangerous than others, and this still is a very dangerous disease. And so even if it's endemic, there's still a lot to be worried about just because it can still have the potential to cause a big health problem.
Ultimately, it's the World Health Organization which would declare COVID-19 an endemic. A spokesperson for the WHO has recently said redefining coronavirus as an endemic is, quote, a ways off. Reporting in Milwaukee, Rebecca Clough, TMJ4 News.